The service has been running a little bit over 2 years, and while there was a little bit of reluctance at the start, it would seem, things have picked up since, and we've now seen about 130 referrals and people coming through on a very regular basis.
Yes, I have a joint appointment with University College London, where I teach and do research on the nature of post-traumatic stress, and particularly in relation to veterans' problems with post-traumatic stress. And I also work part-time in the traumatic stress clinic, where I treat patients using cognitive behaviour therapy.
I think it's worthwhile saying in the first instance we're NHS trained and we are experienced. We have a broad foundation of skills in understanding adult mental health generally, and that's important. But more specific to that, everyone currently involved in the program has specific experience with veterans and specific experience with people who've some of the difficulties that veterans typically face. They may be depression, may be problems with alcohol and drug abuse. Certainly some difficulties with managing anger is often what we find, and a post-trauma response is something that people talk about quite regularly, and certainly in this clinic there is expertise most would rate as second to none in terms of managing post-traumatic stress disorder. As a service that was serving a very local catchment area prior to the London bombings, it was quite internally focused. The result of the London bombings was that we have an expanse in experience at working with people pan-London. And essentially what that means is that we have populations from far and wide who had exposure to a very specific but very traumatic experience, something that they completely weren't expecting, that's had quite an impact on their everyday life thereafter. They're different people as a result of that experience. The clinic has experience in recruiting, providing a friendly face to individuals who find these sorts of things very difficult to talk about, and also now have gathered enormous expertise in helping with those problems. There's very few who've left who've said that they're not better as a result of coming into contact, engaging in an assessment and considering treatment.